As the slide says, this video is for educational purposes only. If you have issues or questions, contact your own primary care provider, go to the emergency department, or call 911. So I titled this video, DragBoss. Who is he? And what does he know about back pain in the racer? Or anybody with a spine. And the reason I put racer in there is because I'm a drag racer. And I know most of the guys I'm going to post this on are too. So the introduction is going to be a little bit emotional because I can't explain it. I don't have to explain it. You can skip past that, but I want to tell you who I am and why I made this video. What's up, guys? Tim Halston with DragBoss Garage. You know what? You've probably heard me say that probably 250 times since I really started working on this channel a few years ago, because that's about how many videos I have up. But you guys know me as Tim Halstead, the guy that has a Cougar that wheel stands, the guy that races Cleveland's for 40 years, the same car for 40 years. And there's a few of you that know who I really am. And I decided at this time, since I'm turning the wick up, and that's what I call it, turning the wick up, because I've only been burning about a quarter flame, and now I'm putting it up full blast, because I'm going to start making this channel something you've never seen before. And you can see, if you've been watching and keeping up with the videos, you already know that's coming to fruition. I have come to the decision at this time that I'm going to start another channel. A channel that's specifically for physician assistants or anybody interested in medicine. And that's going to give me the segue of where I am right now. So I want to give a big thanks to my family, my wife Andrea, Izzy and Elena, and also my mom and dad, who are now deceased for many years, and kind of tell you where I came from, and then maybe you'll see where I'm going. And I'm sorry to get emotional because it's something I don't share with many people, and I think it's time that I need to. So let me start from the beginning. The story goes as my parents told me that I was left on a park bench at 6 months old. And I was found by a ranger and brought to an orphanage, and my parents got me when I was like 2 years old. And other stories that my parents told me is that I was found under a rock. And they were walking along a beach and kicked a rock, and there I was. So I'm not really sure where I came from. But I can tell you that I'm adopted. I also have a brother and sister that were adopted. Now my brother lives here in Sandusky with me. That's a whole other story. You've seen him on another video. And when I get to the PA channel, I'll give you more information on that. My sister, who has 11 kids, she died of an overdose. So I won't get into that, but all that stuff hits home. So I kind of want to give this introduction before I get into on back pain, so you know where it's coming from. That's not just some guy that drag races and has some back pain and took some Tylenol or ibuprofen. But I grew up in a family that was in the military. My dad, he was in 3 wars. The end of World War II, he was a prison guard in Nuremberg prison. And I have his prison pass to prove it. I have all this memorabilia from Germany, from the Nazis, and his stuff he's collected. He's also in Korea, and then he retired from the army at that time. And I don't really know much about what happened to him or where he went after that, but I'll take you into 1970. In 1970, my dad got called back into Vietnam. And he left our family. I was 5 years old. And I don't know about you guys with your memory, but I can remember at 5 years old, I can remember lots of things that happened to me at that time. And he was in the 101st Airborne and the 82nd Airborne. He's a paratrooper and a medic. And he used to send us tapes, and I said this on a live chat with my family that I did last week. And about once a month we'd get a tape, and he would tell us what's going on. And in that tape, you would hear the explosions and stuff going off. And he said, listen, I got to go, guys. I got wounded. I'm gone. And then we never knew if we were going to hear from him again. He said, he loved my mom dearly. He sent her a letter every week through airmail, and I still have those letters bundled up. I never really read them, and maybe it's time. And my mother kept a diary all through her life. And it describes the situations in the life that we had as kids. See, I grew up in a life like this, and my kids said it before. It says, "Dad, don't play." DBG, best dad ever. And I will tell you this, my dad was the best dad ever. He was very strict. He told you to do something one time. There was no second chances. After that, it was corporal punishment. And as a young boy, you learn to listen. He always said, you're never going to learn anything if your mouth's open. And he had a lot of things that he would tell us and say, and I remember him. He always said, if you don't listen, you're gonna die. And I think that came from the Army in combat, because you had to listen and pay attention or you were dead. He told me tons of stories about Vietnam. He wouldn't talk about it for a long time until I became older. And actually it was before he was gonna die with lung cancer from Agent Orange. And tears fill my eyes when I talk about this, because he was a humble man. And he taught me the important things of life. The things I try to teach my kids about being honest, trustworthy. He taught me the important lessons of life about what you need to survive, how to build a fire, how to build shelter, how to identify trees that are beneficial and not, how to identify poison plants. My mother was a big proponent of that. She was a nature freak, I guess I would say. She made her own bread. We ate tofu. We had all kinds of different things. We were self-sustaining. And that's how my dad felt. He didn't need anybody else. He was kind of a loner. He didn't share a lot with me about his life. Very few anecdotes and stories. But what he told me was the important things in life. The things that matter. Not whole society in general, but about family. And those are the things I kept to my heart. And those are the things I based my life on. And it's hard to express this, and I know it doesn't mean a lot to you, especially about back pain, because that's what you're here for, but I have to get this out because I want you to see where I came from and why I think the way I do. And I want to give a thank you to my mother, my biological mother and father, who left me on that bench or wherever. Whether they couldn't take care of me, I don't know. They didn't like me, I don't know. It hurt me throughout my life. Because I was told I was Indian, I was called Cherokee all the time. My mom told me I was Lakota Sioux, you know, because I'm darker than other kids. I got made fun of all through my life as a younger kid. We didn't have much. We didn't watch TV. That's probably why I don't watch TV today. We read, we learned, we were outside all the time. And I was a kid, we had encyclopedias, and that's what I had. When I didn't have anything, I would go and read encyclopedias. Encyclopedia Britannica, and they were red in color, I remember that. And they had mold in them or something. I would start reading those, and I'd have terrible allergies and sneezing. But somehow after I started reading them, I would just get past that, and then I was ingrained with them, and I read every one of them, not cover to cover, but I picked out and went through every page and read what I thought was important. So, as I became a teenager, I was a bad kid, the worst. I don't even know how many times I can tell you I was arrested and was in fights. And my parents grew up strict as Mormons. And I rebelled against that religion and those beliefs because of things that happened in that church that were not right, which is not typical of Mormonism or Mormons. But they gave me the values I have of being honest, trustworthy, determination, ambition. And I did well in school, just enough to get by. I could have done way better if I wanted to, but I didn't. I got into the wrong crowd. And I left my home 3 days after graduating high school and said, I'm out of here. I don't need this anymore. And I went out on my own, and I never went back, except for sometimes to do my laundry or to get something to eat, because I realized at that point how smart my parents were. But I remember many times telling my mother I hated her and I wish she would die because I was selfish and I was mad because I didn't get what Tim wanted. And my mom, her name was Helena. She died when I was 21 years old. I'd only been gone a short time. My mom was 53 years old when she died. R.I.P. Helena Rose. My dad, David R. Halstead, he died at age 83 from an inoperable lung tumor in the left lung. And there's a whole story, I'll tell that on the PA channel, that I'd like to share with people. So I love my parents more than ever. I just wish I would have realized what they were doing for me at that time. But I do now. And I try to instill the same values into my kids. And it took a long time to get over that it wasn't my fault. And I have the diaries that she has that she wrote about having blood in the stool and having the pain and not going to the doctor. Because we didn't go to doctors. In fact, I'd never been to a doctor in probably 50 years. Check out my own labs and do all that kind of thing. Let's keep going. Yeah, that's a warning sign telling Tim you better get to a doctor and get evaluated, because I haven't had a colonoscopy. So I left home and I went to work for Midas. Before I was in medicine, I worked as a mechanic at Midas, learning exhaust system, brakes, and suspension. Did a ton of that stuff. I didn't think it was right for me, and I left and I went to work for a transmission shop in Syracuse, New York, for a guy named John Staffy. Get his transmission. I learned that he could teach me things, and he taught me how to build transmissions and how to do stuff. Taught me a lot about everything, about life too, and about how to deal with things. And it was while working at that transmission shop when I first started school. I had to take 3 semesters of non-credit math. And I used to sit in the lunchroom that he had there, a little kitchen, and do my math homework diligently, because school started at 6 o'clock at night. And I remember sitting there at that table thinking, why am I doing this? Where am I going to go with this? But I had the opportunity to go, and I did it. So thank you, John. I went to work for a guy named Mike Shenick Auto in Marcellus, New York. What a great guy. He had 5 kids and a great wife, great family man. And he taught me a lot about life and working on cars. It was a shop that was from the 20s, had old neon dealership signs in there. We never had a lift, we had a pit. So I never worked with a lift after I left the transmission shop. And Mike was the kind of guy that said, hey, you're going to school, you work when you can. I mean, I used to go there at night and do head gaskets and do all kinds of work when I could. He worked around my schedule. I also worked for the Red Cross doing tissue harvesting. I got into that because it was a way to learn anatomy, and it's kind of a gruesome type job, I'll tell you. But basically you dismember people after they've died and they give their body up for science, or tissue harvesting really. They come and harvest the eyes or enucleate the eyes first for corneal transplants. Then we would come in and we would open the chest sometimes. I'd cut the heart out, go in dry ice. We package everything in dry ice. I would use a dermatome and skin people and take the skin, the epidermis off the arms, off the legs. Also take the fascia off the legs, the fascia lata, harvest that. Everything went in dry ice. I'd open up the thighs, dismember the thighs, cut it open and tear out the femurs. And that's really what it was, tearing out with a scalpel and knife, just cut and tearing the bones out, dismembering, disarticulating the knees, disarticulating the hips, and just yank out that long bone. That's how it's done. We would put in dowels, like broom handles, inside where the bones were, and then I'd sew it up. That way it would have a little bit of a semblance of some kind of stability when you go to move the person. But one time, there's a young kid, 16, who put a shotgun in his mouth and blew the back of his head out. And that kind of bothered me a little bit, but I can handle any blood and guts and gore. I mean, I learned to trap as a kid and skin animals and hunt, so it doesn't bother me. But what bothered me was there was a note that came with him, a suicide note, of why he did this. And when I read that note, the pain in that note went through me like a bolt of lightning. To hear the pain he went through with his mom and dad, and the fact that he felt unloved, and that his other sibling got everything and all the honor and all the glory, and he got nothing. It put something in my mind that I can't explain. And after that, the smell of that blood and the tissue and that whole situation, I never wanted to do again, and I stopped doing it. So if you're interested in doing something like that, it pays well. They put you on call. I think it was $20 an hour back there. You'd get paid. It would take about 6 or 8 hours to do this, and usually did them at the morgue or an operating room. So, while working for Mike, long story short, he started dropping wrenches. And I remember, I'm like, what's going on, Mike? Then he was diagnosed with a brain tumor, glioblastoma. And after that, he had surgery, and he couldn't walk for about a year, but had a lot of physical therapy and got back on his feet and walked again. And he ended up working in a foundry, as he had a college degree in like metallurgy or something. And then he did well for a few years, and then the brain tumor came back, and he was in a wheelchair after that. And somewhere around 2010 or 11, I went to see my dad, probably right before he died. And I almost think it was the same time. But I went there after Christmas. By some chance, I can remember his address and his phone number to this day. I called him up, and he answered. He said, "Come on down, Tim, my dad's here." So I went to his house. We talked for about 3 or 4 hours and caught up because I hadn't seen him in years. And we shook hands and hugged, and I left. And I got a phone call from his wife on New Year's Eve that Mike had passed. And I don't know, it was meant to be. And maybe on my PA channel, I'll tell the story about my dad that was a similar situation. But that's kind of where I was. I worked all through school as much as I could to try to pay for everything. And I got a lot of help and financial support from my cousin, Dave and Kathy. So thanks, guys. I appreciate that. I'll never forget those lessons I learned. And after my mom died, they called me to their house and they said, "Listen, Tim, we know you're a smart kid and you got potential. And we want to give you the opportunity to go to school with the preface that you're going to pay it back, the loans we give you, and you're going to give that opportunity to someone else, whether it's someone else or your kids." So I started school at Onondaga Community College in 1987, and I went into a surgical tech program. I always wanted to be a doctor, so I said, well, I better figure out how to help a doctor and know what's going on before I go to medical school. And I don't think I was ready for medical school. I had no college training. I didn't have any undergrad, so I started there. I did really well. I graduated with high honors in 89, and I said, you know what, I got to keep going. My cousin said, listen, you keep going. Don't you stop. So I went and did my undergraduate school and got my degree at Lemoyne College in Syracuse, New York. It was a Jesuit college, private school, based on Catholicism, you know, the Jesuit teaching. Although I'm not a Catholic, you know, it was interesting to learn that stuff. And I went from 91 to 94 and got my bachelor's. At that time, I was going to go into medical school. That's a whole other story I'll tell you at the PA channel when I get to that. And I didn't have the ambition and drive to be a doctor. I always wanted to be an orthopedic surgeon. So I said, you know what? I worked in a hospital with my surgical tech degree for like 6 years. I worked at Community General Hospital and learned to scrub every operation there was. I've scrubbed craniotomies to vasectomies to every bowel resection. And I'll stop it at that. Any general surgery, carotid, aneurysms, dissections, I didn't stop. And at that time, there was a physician assistant there named Tom Weinheimer. And his wife also worked in the operating room, Sarah. She was a nurse there. And he was a physician assistant. And I followed him around and kind of got the gist of it. And I said, you know what I want to do? We had a couple schools back then in New York. And they only took about 20 to 25 people at the most out of 3,000 to 5,000 applicants. And I didn't get in. So I talked with my biology professor, Dr. Mitchell, Beth Mitchell, and Beth Pritz was there then. And I said, we should start our own PA program. And long story short, Lemoyne College started a PA program and I was in the first class. Now, I was not some milestone and did everything for it, but I did a lot of work to help those guys out in our class in 1998. And that was 96 to 98. Got them a lot of rotations at Community General Hospital where I worked as a surgical tech, and I continued on. I think what I'm going to do is stop it there because this is more appropriate for the physician assistant channel. But I will tell you the experience and we'll get into the back pain. Total right now, I've been a PA for 25 years. And in that 25 years, I've seen 2 years of orthopedic surgery and started a practice at Victory Sports Medicine. And I did cardiothoracic surgery for 13 years. Open heart surgery, lung surgery. I can't count how many cabbages or open heart surgeries I've done. Hundreds. Valve replacements, dissections, aneurysms, aortic arch replacement, circ arrest. These are things you can look up if you wonder what they are. I learned to take a vein by opening up the leg, the open procedure. And as I progressed through cardiac surgery, I learned to take the whole vein out of the whole leg, the length of the leg, an incision about this big, 1 centimeter. I could do the whole leg down and up on a good leg that was easy to work with. Probably less than an hour. I can remember doing cabbage times 3. So that's 3 bypasses, skin to skin, in like 2.5 hours. That was our record when I worked with Jose Noberto. We would do sometimes 2-3 open heart surgeries a day. I think our record was like 12 in a week, sometimes less, sometimes 4 in a day, depending on the emergencies. But I learned so much doing that because it was just him and I. And managing those patients post-op was a phenomenal learning experience. Along with the cardiac team we had. Awesome nurse practitioner, Jackie, great work. Those were the days. I'll talk about more of that later on the PA channel because a lot of stuff happened back then. Worked in an emergency room for 10 years. So I've put my time and I have a lot of experience. So I love this channel with DragBoss Garage, but I know I have enough information to share with others that I can start another channel because I don't want to not contaminate this channel, but not all you guys are going to be interested in this. But if you are, and you have kids or relatives that want to be a PA, that want to know about being a physician assistant, then you're going to go to that other channel. I already have physicians lined up and surgeons that want to come on and do live chats and we talk about emergency medicine. So with that, we're at like 20 minutes. I'm hearing about Tim. And again, I got to give a big shout out to my wife, Andrea, who I love with all my heart, and my kids, Izzy and Elena, because they keep me going and give me that drive to succeed. So let's talk about back pain for the racer. And that's what I named this lecture or this video, because it's going to go on all these channels with racers. But in reality, it's anybody with a spine because everybody has back pain. It's one of the largest complaints out there. But back pain is not just back pain when you work in an emergency room. And this is what I'm going to try to get you to understand. So I'm going to kind of teach you from a medical perspective, but also from a racer perspective. And hopefully I can get this across. I know this is going to be a long video, but it needs to come out. So here's how we're going to work it. In medicine, and we're talking from an ER perspective, but it works in all specialties. Doesn't matter if it's primary care, orthopedics, dermatology, cardiology, gastroenterology, anything with an ology, it'll work. Everything's based on a differential diagnosis. And when you say differential diagnosis, we're not talking about a differential Ford 9-inch. What we're talking about is all the things that can encompass back pain. What can cause it? So here's what I'm going to do. I'm going to do a differential diagnosis of back pain in the ER. And the most common you think of is mechanical strain. Oh, I lifted that box up wrong. Because everybody has, not everybody, but the majority of people, and the reason for back pain is poor posture. Sitting back in that chair, leaning back and slumping. Terrible for your back. Bending over, and I won't do it because I have a bad back now, and that's why I can speak about this. Bending over, instead of using your legs and bending over the waist to pick things up. That's the most common. That's easy to figure out by history. And when someone comes into the emergency room and you're trying to figure out what's going on, history is key. Get that history. Too many people go, oh yeah, back pain. Okay, they bent over and lifted something, but they don't ask any further because those are the things, that's when you're going to miss something. They always say that the patient's going to tell you the diagnosis, and the majority of time they can, and their history is so important. Don't miss that. The other thing that's most important is a physical exam. Know that physical exam, because if you don't, you're going to miss things. And I see students today, I've been precepting now for 20 plus years, to the point where I told the schools that I don't want to do it anymore. I gave back enough for 20 years, I don't need to do it anymore. Having students is tough. It slows me down. It can cause me to have mistakes if I'm not thinking clearly. But also, you got to give back to those kids, those guys, those men and women. It doesn't matter, they're not all kids, that want to be a PA or whatever. I've taught residents, okay? I've taught medical students who become surgeons, plastic surgeons. I've taught them how to suture. That's one of the skills I have that no one can take away, is I can suture and close any wound better than any doctor in that hospital I work at. And I'm putting it on here, and I'll challenge anybody out there. When it comes to trauma, I can fix anything. I don't know what it is. I have the hands that God gave me. And that's the gift I have. Some people can play sports. I couldn't throw a baseball to save my life. But I can work with my hands, and I can fix things like engines, and I can fix people and help them out. So let's get back to the point. So they come in. So that's the most common thing you're going to see in the ER is back pain, mechanical back pain. Trauma's the next thing. Not really hard to figure out because it's trauma. They came in from an accident, they fall, whatever. We'll leave that as a whole separate ball game. Then other things you got to think about now, when people come in, and one of the most worrisome or concerning things when someone comes in for back pain, you got to think about pulmonary embolus, blood clot in the lungs. Okay, you might think, oh, the lungs and chest are up here, and they are. And most of the time, people have chest pain up here. Blood clots are a whole nother lecture I'm going to get into. But remember, the lungs, the base of the lungs come down to here, down towards the retroperitoneal area where the kidneys are. And you get a blood clot in there, and I've seen them before, they can give you back pain. Those are things you have to pay attention to. So in vascular, you got pulmonary embolisms. You got retroperitoneal bleeds, you got aneurysms, you got dissections. Again, I'm going to do whole lectures on that because until you see it, you can't really diagnose it as easy as you think you can. Then you get into stuff like, pneumonias and respiratory issues that can cause that back pain. Never underestimate malignancy, cancer. It's always in the differential, no matter what you're talking about. I can't even count how many people I've seen that come in with back pain, and I examine them and I get a CT scan and their bones are full of mets, lytic lesions into the bone. Prostate is a popular one. So that can never be underestimated. Infectious etiology. What is that? Discitis, an infection of the disc. You got meningitis. Mostly you think about neck pain and meningeal signs and stiff neck. But meningitis can come from any aspect. Okay, the meninges are through the spinal cord. We're not going to get into that anatomy. So the other things you think about, kidney stones, they can cause back pain. All right, kidney stones. How about kidney infections, pyelonephritis? You can die from pyelonephritis, a kidney infection. It can come from a stone. People with kidney stones and diabetes, watch out. Okay, then you got abdominal pain. Any abdominal pain can present or mimic a back pain. So think about that. Diverticulitis. Now let's stop there. So those are the differentials, okay? You got mechanical, you got trauma, you got vascular, you could count respiratory in there if you want. You got infectious etiology. Also, you can throw in neurologic manifestations too. Schwannomas, tumors in the spine, but I would go back and kind of say that could be malignancy too. So let's talk about the axial skeleton, the spine. And I got this spine model, I ordered it on eBay, because for me to try to talk to you about back pain, you're not gonna get the issue, you're not gonna understand it as well as you might think if I can't show you. A picture's worth 1,000 words, and when it comes to back pain, it sure is. So we're gonna use just mechanical back pain at this point in time. So forget all that differential now, keep it in the back of your mind, of course. And remember, I'm gonna put a preface in the beginning of this video. What I'm telling you is for educational purposes only. I'm not here to diagnose your back pain. I'm not gonna make predictions on your back pain, and I don't want you trying to sue me for this, because I'm trying to educate you. Nothing beats knowledge. And that's how my YouTube channel is, DragBoss Garage, because you're always learning something new at DragBoss Garage. When you have knowledge behind you, no one can stop you. So here's a back pain model, the exoskeleton. I gotta put up shout out for my kids. You can see it there, top dad. I appreciate that, girl. Cervical spine's up here. 7 cervical vertebral bodies, okay? The thoracic has 12 vertebral bodies, and the lumbar spine has 5, plus the coccyx and the sacrum, all right? We're gonna stick with the lumbar. Between all these vertebral bodies are the discs, and you can see them here represented here on this model by these little interspaces, right here, these clear spots. And those are the shock absorbers of your body. Think about it, jumping up and down, walking, climbing. Anytime you're moving that spine back and forth and flexing it, that's what kind of helps you absorb shock and energy. The problem is, as we get older, these discs desiccate, they dry up. People don't drink enough water, they dry up. Injuries, wrong lifting, anything like that can injure that disc and cause problems. And with problems come pain. And that's the biggest thing about backs is pain. Everybody comes to the ER not because they want to bring you lunch, not because they want to talk about something, it's because it's pain. That's the majority of things that people come in for is pain. People have an issue with pain, instead of living with it and trying to figure out what to do, they rush to the emergency department. And this is what I'm trying to do, is educate you so you can treat your own back pain. Because I'll tell you right now, if you're a racer and you've been racing and you load your car and unload all your junk to go to the track, I guarantee you got back pain. So let's talk about why you have it. Because of a strain, right? You can strain the paraspinal muscles, all the muscles that keep you upright and connect your spine, the vertebral bodies together. Paraspinal muscles can get strained. Any muscle strain can occur from overuse, from lifting something heavy, anything. In this case with back pain, a lot of times that will get better over time. Usually the back pain will improve within a couple days, some Tylenol, ibuprofen. Other times what happens, and this is what we're gonna get into because this is where the big issue is, and that's when you have a herniated disc. And I have a herniated disc. I've experienced 2 of those, and I'll talk about that on my PA channel and get more in depth on that. But I know right now that a lot of people here have ruptured discs. I talked about it on my live chat with my family. There's at least 3 or 4 guys that talked about it. And that ruptured disc, and this little model has a example. It's right there. Let me get in here and show you. So what happens is that disc, from doing something wrong, lifting something wrong, bending, trauma, whatever it is, that disc herniates. Inside that disc, it's a gelatinous material called the nucleus pulposa. And I've done back surgeries, and it's not like a liquid that pours out. It's a thicker type tissue with a gelatinous component. And it squeezes out, it gets pushed out. And most disc herniations are posterior lateral. Posterior is back, lateral is to the side. And this kind of represents that. They're not anterior, although some are. When it pushes out, that disc material pushes out, it pushes against this nerve root, that nerve root. And that's what they're trying to show you on this model. All these little yellow things coming out, my kids like to do this. These are the nerve roots, okay? And when that disc pushes on that nerve root, that's where the pain comes from. Now, what you get when you get pressure on that nerve root is called a radiculopathy. Radiculopathy. I'll say it again because people need to know that. The nerve roots operate the muscles in your legs. They tell them when to contract and flex. They tell them when to release so they can move forward and you can walk. So you have muscle strength to move and kick and all the activities that you do. Loading your car with the slicks, your floor jack, all from the nerves. Now when those nerves get pushed on and that radiculopathy causes pain, that's the pain you're feeling in your back. the most common thing you hear is sciatica. Oh, he has sciatica. I have sciatica in the back. And the majority of people that have sciatica is usually about 90% from a disc bulge or herniation. You don't always have to have a herniated disc. Disc bulge, when they bulge, they get inflamed, they get swollen, they get pissed off, they push that nerve root, they shoot pain down your leg. So let's put this guy where we can see him, right on this set of carburetors. So I'm gonna put a chart up here so you can understand what I'm talking about. So it might be right here, or I'll put a slide. But what they figured out by doing EMGs, or I don't know exactly how they did it, but there's a chart called a dermatome map. And you need to look it up to understand this. And like I said, there's gonna be a copy of this. The dermatome map tells you what nerves are affected by what level of back disc herniation. So if you have a herniation, let's say an L5, and it's pushing on these nerve roots, that's gonna send pain down your leg. Depending on the severity of the disc bulge or herniation will depend on the radiculopathy and how severe it is. L5 dermatome, when it gets irritated, it sends pain down your legs. It affects, we'll use your toes because it's easy to see and understand that rather than the map on the leg, which you'll see on the chart. But it affects the second, third, and fourth toes. That's L5. L4, if it gets affected, affects the big toe. S1 and S2 come down the back of your leg by the calf and your heel. And I'm not going to go into any more of the patterns because you'll be able to see that on your own when you look at this and figure out where your own pain is coming from. And obviously you can have multiple levels, push on multiple areas and have the pain going in there. Now when you have this pain, what do you do about it? Well, here's what your choices are. Live with it and do nothing. A lot of times radiculopathy pain will get better as that heals, as that area that's bulged out scars across and the inflammatory process decreases, the inflammation decreases, it takes pressure away from that nerve, and a lot of times it'll get better over a month or so. Sometimes it never gets better. So when you get this pain in your back, whether it's a mechanical pain or it's a radicular pain, your option is this. The first thing you should do is start on anti-inflammatory medication. Now, what do you take? You can take any of the anti-inflammatory NSAIDs, ibuprofen, Advil, Aleve, Motrin. They're all over the counter and they're all anti-inflammatory and pain relievers. But for them to work, you got to take them more than once a day. You can't just take it, oh, I took it, doesn't help. I hear that all the time in the ER. You have to take them to build it up, that level of NSAID, we'll call it in general, to steady state in the serum of your blood for it to work efficiently. So you need to take it 2 or 3 times a day. You could actually take it 4 times a day, but the risk of a GI bleed or a gastritis in the stomach outweighs the benefit of getting a pain relief from it. And that's up for you to decide. Tylenol also is underestimated. You need to take, though, again, at least 3,000 milligrams a day for it to be effective. And you can take Tylenol and Motrin together. That's the best pain relief you're ever going to get. Again, do not take more than 4,000 milligrams of Tylenol in a 24-hour period. And to clarify, when I say the best pain relief, that is for over-the-counter type medications, Tylenol or NSAIDs. The risk of NSAIDs is GI bleed, ulcers, gastritis, so use these with caution. Make sure you take them with food. Now, what else can you do? Now you can go to the back pain area and look through all the back pain stuff and try to figure out what works for you. Since I had a herniated disc on 2 occasions and I just got better, the thing that worked for me was Tiger Balm ointment or patches. It seemed to work the best. It's from China. It's thousands of years old. There's a million other things that you can try. Just like NSAIDs, some work for others and some don't work for others. Aleve may work for you, it doesn't help me, but ibuprofen works for me. So those back pain things that you can see all over the box stores, Rite Aid or whatever stores around you, try them and see what works. There's BioFreeze, Dones, back pills. You just have to look and see what works for you. Now there's a whole other myriad of drugs that you can get that are different types of NSAIDs that are prescribed, like meloxicam, Mobic, Celebrex, diclofenac. That's a whole nother topic to explore. One of the things you can get over the counter that works great, and I buy a tube every month, for aches and pains. It's called diclofenac gel or Voltaren gel. You can buy it right over the counter. It's only a 1%. So you can get a 3% prescription from your doctor. They make it 10% in Canada. But I'm telling you, that stuff works very well. So think about that. But if you're taking the topical NSAID, using it, don't take the oral NSAIDs that I had talked about. You don't take the mouth, ibuprofen, Aleve, whatever, and then put the cream on you. Don't do that. You'll have a GI bleed or gastritis because it does have those side effects. Other options you can do are go to a compounding pharmacy. Either talk to your doctor, you can even talk to the pharmacist. They might be able to make you something up that's not prescription. But compounding pharmacists are rare. And a compound pharmacist, which there's not many, they take the ingredients that they have to work with and make salves, tablets, pills, oral solutions, whatever the route. But those definitely can help. Now, what else works? One of the best things I've ever found came from a patient who was like 75 when I had this back pain back in 2016 and 17. She saw me kind of limping, and I had it so bad, the radiculopathy down my leg so bad I was getting foot drop. And that's when the nerves get pushed on too long and you start losing the reflexes in your foot and your foot starts to drag. And she noticed that. And I told her what was going on. She said, listen, son, you need to use Epsom salt. I'm like, what? Are you kidding me? Yeah, let me tell you, Epsom salt. It's a mineral. It's been around for 1,000 years. Okay, and I'm not promoting any brand because I don't know any other brands. I just know what she told me, and that's Dr. Teal's. And so I started to use that. Dr. Teal's, the regular Epsom salt, and they have a foamy bath. And I'll tell you, me and my wife take 3 baths a week. It's great therapy, let me tell you. And I'll leave it at that. It works so well for inflammation, you can't believe it. At least for me. But it's got to be warm, and you got to soak in it for about 20 minutes for it to work. And that goes for any body part, a hand, an elbow, foot. A disclaimer, if you have any renal insufficiency or chronic kidney disease, be cautious because Epsom salt is really magnesium sulfate, and it gets absorbed into your system. Magnesium sulfate is used to treat torsades de Pont, a lethal arrhythmia. It's used to treat eclampsia in pregnancy. So it's a great drug. So think about that. What else works? Is proper posture. Sit up on the edge of your chair with your back straight. When you sit back and lean back there, that pushes that disc out. That disc is going, push it out against that nerve root. You got to keep that pushed in. You got to sit straight. The best thing that worked for me is physical therapy. And I don't care what anybody says, it works. The problem with physical therapy and working in healthcare, and I see it, are people are lazy. And I'm telling you that. You're lazy. I'm not calling you that directly, but I'm saying the population in general. They go there to physical therapy, they do the exercise that they're assigned, and when they go home, they don't do them. They think, well, I'm going there and I should have it, it should work fine for me. That's farthest from the truth. I did physical therapy, my exercises that I learned, but I did them every day, twice a day for 4.5 years. And I stopped in February of 2022 because I had no pain, I was doing great. And by October, I had an episode. I think it was training Zeus. I ended up with a tear on my foot, a plantar plate tear, which is another video I will do. And I started walking crooked. I think I re-herniated the disc. When I talk about physical therapy, there again, it needs to be prescribed by your doctor. But trust me, get the book of McKenzie exercises. Robin McKenzie wrote a book on both neck and back pain. He probably has more books. But those books work. And basically what they are physical therapy exercises to help get rid of the pain. And the gist of that physical therapy, because there's a lot to it, basically the pain going down your leg, you want it to centralize and go back up into your back. It's okay to have back pain. It's not okay to have the pain going down your leg. So keep that in mind. One of the easiest exercises you can do is lay on your stomach with your arms out and your head to the side, with your legs open, spread eagle-like. Just lay there. And depending on how long you've had the radiculopathy, the pain will actually travel or centralize up the leg and centralize in the back. It'll hurt probably a little more in the back, but if it ain't hurting and going down the leg, you're doing good. So think about that. The other big option is chiropractic treatment. Now, I'm not a big proponent of chiropractic treatment because I don't know much about it. I was always the kind of guy that said, look, if it ain't broke, don't fix it. I don't want someone yanking on my back or pushing it back into place to try to get rid of it. Now, it may work for you, and that's up to you, and you can share it in the comments. I'm not against it. You know, there's so many different holistic methods to get rid of back pain, and that's something you can research on your own. I'm just trying to give you the basics. So, physical therapy, I cannot underestimate it. Works. And I got to give a big shout out to Steve at my hospital. He's the director of physical therapy, and he helped me, and it made a big difference. Now, as we talked about medication that you can buy over the counter, now there's a whole nother group of medication that you have to have prescribed, and that includes opiate-based pain medication. Steroids is another one. Steroids work. You've been on prednisone, depomedrol, dexamethasone. There's a million different kinds, and they're prescribed for certain reasons. Let's use prednisone for an easy answer. Now, in prednisone, one of the basics is just 40 milligrams a day for 5 days. All right? Simple. It works for COPD exacerbations. It works for back pain. It works for any inflammatory aspect. Make sure it's inflammatory and not infectious. Make sure the pain in their leg is from mechanical strain or issue, not early cellulitis, or you'll end up with an issue. Take it from me, I learned. Now, another disclaimer. When you use steroids and you're diabetic, it's going to cause hyperglycemia or elevated blood sugars, so monitor it closely. Now, the neurosurgeon, who's a buddy of mine, who I saw with this exacerbation of back pain, recommended doing 9 days of steroids or 10. But you got to be cautious if you're writing for steroids. You got to watch out for rebound effect. We're not going to get into that here. If you're writing it, you better know about that already. What else do you have to do? Well, then it comes into pain management, where you get epidural injections to try to reduce the inflammation. I hear so many different things that it works, that it doesn't work. Only you can decide that. And then what else is there? Surgery. That's where it comes down to. You're not getting better. Your pain is out of proportion. You can't live with the pain. Or you're getting some kind of neurologic manifestation. What I'm talking about is what I had. Weakness in the leg, loss of reflexes, foot drop. Surgery is indicated at that time. So talk to your own doctor, talk to a neurosurgeon about that. I enjoy surgery. Did it for, I'm telling you, at least probably 25 years I've been in the operating room, like I said before. But I don't want to have it done to me if I can help it. So I'm always conservative when it comes to surgical intervention. Now, I'm trying to button this up since I've been here for a long time. You got to excuse the emotion that I gave you on this lecture because I've never done this before. But I want you to know who I am, and that when I speak to you, I speak from my heart. I'm not pushing any kind of BS on you. You know, I'm not here to get subscribers, although I like that. That's how I'm going to build my channel and bring you content you've never seen before. But I want you to subscribe because you like me. You like what I'm doing. You learn something from me. Not because I ask you to do it and push the button and ring the bell. That makes no difference to me at this point. You get subscribers by content, and that's what someone told me. And that's why I turned up the wick, to show you what I can provide for you. Education and knowledge, because that's more powerful than anything. And I'm going to leave it at that. I may miss things, and I may redo another video on back pain after I've seen this or you guys comment. But I want you to know that you're never going to get better unless you put the effort in. You get better by you, not from some medication, not from someone telling you what to do. It only comes from your drive and ambition to get better, right in the heart. So I appreciate you being here. Stay tuned to DragBoss Garage, not just DBG, because I want you to remember that name.